So one, I'm going to answer this question, but at a higher level. One of the things that's really important for everyone to know is how vaccine comes into the county. So there is a process where we partner with the state to identify allocations to various organizations, and those organizations receive vaccine directly. So vaccine can go directly, say, to Baptist or Methodist or UT. Then there's a portion of vaccine that was coming directly to the health department that we then distributed to the various pods. So that's the component that the city will take over and help facilitate the conversations on the overall allocations. We receive all kinds of other vaccines as well. And so one of the things that's important is that if there are any procedures or processes that need to change, that applies to all vaccine. So we will work on the remediation plan because it's important for all vaccines. And then we will make some internal decisions and make those decisions in partnership with the state as to when we might receive COVID vaccine again in the future. I think we're all very much looking forward to the Johnson & Johnson vaccine. The Pfizer vaccine is a very complicated vaccine. It has a lot of requirements for storage, transit, and so on, and Johnson & Johnson is much easier to manage. And so as we look to the future, our goal would be to receive vaccine again, but the exact date of that is yet to be determined.
Thank you. Next we have Brandon Richard.
Thank you so much. This is Brandon Richard with WMC Action News 5. Dr. Haushalter, have you thought about resigning? And why should the people of Shelby County have any confidence in your leadership moving forward? And I do have one follow-up question related to vaccine administration.
Sure, that's a great question. And there's always opportunities to consider whether one should resign or not resign. So I would say on any given day, that's something I consider. I'm actually at retirement age, so that's something that I should consider and have considered. However, with this event specifically, my responsibilities as a leader are to be very transparent about what happened. And so I have made it my responsibility, and it is my responsibility, to be accountable for what has occurred, to elevate to the state when I knew there was wasted doses, which I did, to work closely with the state to determine what the issues were and to resolve those issues in a systematic and organized way. And from that perspective, I believe I am doing all that I can within my role to be able to demonstrate to the community that our purpose here is to serve the community. If there is an error or if there's a process that needs to be changed, that we're going to speak to that and be able to address that in an open manner.